So the head-to-toe assessment is basically an assessment performed in an emergency situation, like a car accident or an event where there is a situation where you're not sure exactly what has happened to the individual. All right, so we're gonna start at the head, and you're just going to push along the forehead and feel for any softness in the skull or the head. So any, indentations that occur. Remember, the skull should be hard, right? So when you're pressing on the head, it should be firm. We're gonna forehead, back of the head. So we're gonna try to get our fingers underneath the back of the head, and you're gonna even try to slowly bring your fingers underneath this head without moving it too much, and you're gonna almost kind of squeeze. Okay, then you're gonna go to the face. So nasal bone here, you can just kind of go to his cheeks. And just feel around, just make sure. And we're gonna ask, is there any pain with that?
No.
Anytime you put your hands under a surface to where you can't see, you're always gonna check for blood on your hands. Okay, so I'll check periodically. I'll go down to the jawbone, the chin. Then I'll go to the neck. Is there any pain with that?
No.
And I'm just gonna feel for deformities or feel for something that seems to be out of place. And then I'm gonna go to the shoulder and collarbone. So I'm gonna go to the clavicle next. So I'm gonna push both sides, both clavicles at the same time. I can use the pads of my fingers, or I can use my thumb. I'm gonna go to the shoulder next. Any pain with that at all?
No.
Okay. So I also will ask if there's pain here as well. All right, then I'm gonna go straight to the sternum. Okay, and I'm gonna use, this is called the hypothenar area of my hand. I'm gonna use that area to push down. Is there any pain here?
No.
All the way down to the bottom of the sternum. Then I'm gonna check his ribs or torso. So I'm gonna squeeze. Any pain here? Okay. Then I'm gonna go to his abdomen. And I'm gonna go to 4 quadrants. Pain there?
No.
Let me know if there's any discomfort with this at all, okay? Then I'm gonna go to his arms. When I assess his arms, I'm asking for pain, and I'm actually looking to see if they're shifting. I'm looking for fractures, okay? So I'm gonna shift a little bit. Any pain with that? It's a firm palpation. Any pain?
No.
I'm going to his hands also. Any pain with that?
No.
Okay. I can do each digit, that's fine also, but to make it faster, I can just squeeze his hand and shift, and that would be sufficient. Okay, then I'm gonna go all the way around quickly, and then I'm gonna go to his other arm. Any pain here with this at all?
No.
Okay, and I'm gonna squeeze his hands. Any pain in your hands there?
No.
All right. Now I'm gonna go to his pelvis. So his pelvis is on both sides. So all I'm gonna do, I'm gonna take my hands, I'm gonna go to the iliac crest of his pelvis, both sides. It should be firm, and I'm gonna squeeze. So I'm gonna go from this side, and I'm gonna go from this side, I'm squeezing. All right, it should be firm. There should be no movement that occurs within the pelvis. Then I'm gonna go to his leg. So I'm gonna go to one leg. It's very similar to the arm. I'm gonna squeeze. Any pain with this at all?
No.
Check his knee. Any pain here?
No.
I'll shift. Again, try to shift, make sure that there's no movement and make sure it's stable. I will go to his feet. If he has shoes on, I'll just kind of squeeze his feet. Any pain with that at all?
No.
Okay, I can also reach around, across his other leg now. It's closer. Any pain with this at all?
No.
No. How about here?
No.
I'm gonna shift again. Any pain there?
No.
And then go to his feet. Any pain with that?
No.
Okay, now I gotta do his back. So if I feel he might have a spinal injury, I'm not gonna roll him or move him. So let's just say his hand's down here. I'm gonna put both hands, I'm gonna go underneath his back as much as I can. And I'm gonna put this hand as far as I can under the middle of his back. And this hand as far as I can in the middle of his back here. And I'm just gonna kind of climb my hands up his back. Is there any pain with this at all?
No.
So it's gonna look something like this. I climb my hands up his spine and do the best I can. If I don't suspect a spinal injury, let's just say he says it's his leg, he doesn't have any back pain, when we potentially we can ask, he might say, hey, I have numbness in my feet. Well, let's just say we don't suspect a spinal injury. We can roll him. I'm just gonna roll you right now, okay? Just so I can assess your back. I'm gonna roll him and I'll start lower. Any pain with that at all? And I'll go all the way up to his upper back, up to where his neck is, and then I'll roll him back down. Okay, and then that is how to perform a head-to-toe assessment.